All right, everyone, we're going to get started. First of all, just want to say thank you for coming today, for wanting to learn a little bit more about the dental and vision plans. My name is Cynthia. I am an insurance specialist here at Columbia Health, and we have our friends over at Aetna who are going to talk to you today about the dental and vision plans that are supplemental. They are voluntary plans, and they'll get into it a little bit more, but I will just reiterate that they are administered directly by Aetna. So if you want to join them, you can do so. The links are on our website. This session is being recorded, so if there's anything that you miss, you can go in a few days to our website, Columbia Health. We will have a link in the video updated on our website if you missed any information. If you have any questions, please use the Q&A function and we'll get to your questions. I would ask you to be mindful not to share any of your personal or medical information to protect your privacy. And then if you have a specific personal questions, you can email us at Student Insurance, or you can contact Aetna directly with those questions. So with that, we'll go ahead and start. I'll throw it over to Corey.
Thanks, Cynthia, and hello, everyone. Thanks again for joining today. I know you have plenty going on this time of year, so definitely appreciate you taking the time to listen in. My name is Corey. I'm here with my colleagues Matt, Karen, and Angela to tell you about, like Cynthia said, just the optional dental and vision plans that Columbia offers for students. So you might be already enrolled or maybe still considering right now, but regardless, this session will be helpful for you, either scenario. I'll call out now that this is totally unrelated to the medical insurance plan. You and your dependents do not need to be on that plan in order to sign up for either the dental or vision. So I'll start today. I'll walk through the plan design and the benefits at a high level. I'll start with dental. I'll tell you how to enroll online and then what you would receive after enrolling. Talk a little bit about some of the resources available to Aetna Dental and Vision members. We'll have some time at the end for Q&A, but our team will be looking at the chat and the Q&A throughout the session, so feel free to just send them in there whenever you think of them. So yeah, let's dive into the dental plan. Let's see. You'll see in the top left corner, we have the policy number. We have the effective dates. The dental plan became effective on August 15th and is active until August 14th of next year. The open enrollment period has been open since mid-July, but you do have a couple weeks and you have until July 30th. I mean, sorry, excuse me, 30th of this month to enroll for the full plan year. There will be another window that begins on December 15th and closes on February 15th, but I do want to call out that the cost is the same for both windows. So if you think you're going to enroll at some point, might as well do it sooner rather than later, make the most of it. So this plan specifically is a PPO plan or a preferred provider organization plan. And that just means you have in and out of network benefits. It also means you don't need to have a primary care dentist or need any referrals for any of the care that you get. You should still, though, strive to stay in network for your care. You can see while the co-insurance percentages are the same for in and out of network, Aetna has contracted rates with our in-network providers to charge a certain price, whereas the out-of-network providers could charge much higher. And when you go out of network, you typically need to submit a claim for yourself. But co-insurance, also, in case any of you aren't familiar, in this sense is just how much you would be responsible for paying. So it will be either 10%, 20%, or 50%, depending on the type of expense. You'll also see on this slide that type A expenses are not subject to the deductible. And the deductible is just a dollar amount that you need to reach or pay before the plan officially kicks in, air quotes. For this plan, it's $50 for an individual and then $150 for the family. And then so for type A expenses, the plan will pay 90% right away. That wording just means that the deductible does not apply there. Let's see, the annual maximum is just the maximum amount that Aetna will pay out related to your dental care during the plan year. But overall, this slide is just a high-level snippet of your plan. The full plan design can be found on our Aetna Student Health website, which we have a QR code for later on in the slides. We can put into the chat, but it should be easy to find if that fails. Columbia also has its own page on our Aetna Student Health website that houses all of your plan information and more. Yeah, we can go on to the next one. So on this slide, just want to talk quickly about what type A, B, and C expenses even are and what some of the common procedures within each of those categories were. So type A would be your diagnostic and preventive care. That includes two routine oral examinations and two problem focused visits per year. Again, covered at 90% always, no deductible. Type A also includes your cleanings, which you get two of per year, along with some more simple images and pathology. But type B expenses are for basic restorative care. So this includes some more in depth images and pathology, amalgam restorations or composite restorations, root planing and scaling, retrograde fillings, treatment of root canal obstructions and extractions. I definitely don't expect all of you to know what all of these types of dental procedures are. Most likely you would know already if it applies to you, or you might also be thinking you don't see something that applies to you on here. These are just some of the more common claims that we see. So again, I highly recommend checking out the full plan design and benefit summary online. Um, so type C would be major restorative care, such as inlays, labial veneers, crowns, dentures, just the more major care. One call out that I do want to make here is that surgical removal of impacted teeth, including wisdom teeth, falls under type C of the dental plan, but impacted wisdom teeth are covered under the medical plan at a higher percentage. So if you are enrolled in the medical, I'd make sure to utilize your medical plan here versus the dental plan, again, in that situation. And then, yeah, lastly for this slide, just some common exclusions. Um, let's see, coverage outside the US, Canada, or Mexico, anything non-medically necessary, and any services provided by someone in your family. Again, the full details and exclusions are online in the plan design. So the network, this slide, I won't spend too much time on, but the message here is that you should try to stay in network. We have over 497,000 providers coast to coast. So finding one in network to help you save money and maximize your plan benefits should be easy. Again, no referrals are needed with the plan. You have the freedom to go wherever you would like. Shouldn't be a challenge. We have those QR codes later, as I said, but just to show you how to enroll really quickly, first you would navigate to Columbia's page on aetnastudenthealth.com. You'll see these four purple buttons on the bottom left of the slide. You click the one that says Enroll in Dental or Vision. That opens up the page on the right-hand side. Um, Oh, good call out here. Now, with the whole deductible co-insurance language stuff was a little bit confusing, we have a Healthcare 101 document that is very helpful in explaining some of those. Um, at the bottom of the page, you'll also see the full plan design that I keep talking about. The vision plan design is further down the page, but we'll talk about that plan soon too, not to worry. So you would click enroll here, and then on the next slide, and on this page, you enter your ID number. Looks like it's called the UNI or the PID, but leave out the C when you type it in. And then you type in your date of birth and click login. And then the next page opens where you select the plan or the plans that you want to enroll in and whether or not you want to add dependents. And then when everything is selected and you hit continue, you'll be asked to enter some personal information such as your name, phone number, email, your address, same for your dependents, and then call out here, make sure to use your current address because the welcome letters will be mailed there and you want those. The following page just asks you to enter your payment information, then you click submit. You'd get a payment confirmation and a transaction number at that point. And then on the next slide, you got a little sneak peek of after enrolling. This is just for dental again right now. You get a welcome letter sent to the address you used when you enrolled, typically mailed out 5 to 7 days after enrolling. And it looks like what's on the right-hand side of the screen here. It has your member ID, your ID card, and some other helpful information. If you did need to see a dentist immediately, like within that 5 to 7 day window or however long it ends up being, contact Aetna Dental customer service and they can help you obtain your ID number if you need, again, to see a dentist immediately. Using that member ID, you should create your online account, your secure member website account as soon as possible. You can get there right from Aetna.com, but here's the actual URL on the screen too. So, like I said, create that online account as soon as you have your member ID. We have the mobile app version on both app stores, but this is just how I would say you best manage and navigate your dental plan. You can review the plan benefits also. You can look at your out of pocket costs rather, and your remaining deductibles. You can pay claims and access your ID card. I think you can even download it to your Apple Wallet or something like that. If you are on the medical plan, you will have a different member ID number for dental and medical. If you are all already registered for the Aetna member account and you don't see your dental information linked on there for any reason, just call Aetna Student Health Customer Service and they can get those linked. Um, but yeah, you can also search for dentists or the specialists, use our cost estimator tool, see where you might pay for your next visit. There's also information about some of the discounts that are built in for additional products and services, especially like at a CVS. Um, we can flip to the next slide. Here it is. Yes, feel free to take a screenshot or pull out your phone. But here are the QR codes for Columbia's Aetna Student Health page, the Aetna Dental PPO landing page for Columbia, where you can learn a little bit more about the PPO plan and also enroll from there. The plan design and benefits summary I keep talking about, the member website login, and our Find a Provider tool. There's also the Aetna Dental customer service number. That's if you have questions about the plan or how to use it. There's also the Aetna Student Health customer service number if you have any questions about the online enrollment process or maybe need to cancel the plan for any reason. Yeah, I'll leave that for a second. We can pull it back up at the end too. Just yeah, drop something in the Q&A if you have questions. But yeah, we can keep moving forward. All right, so on to the vision plan. Told you we'd get there. Just like on the other slide for dental, you'll see the policy number in the top left, the effective dates. It's the same as dental, effective on August 15th and live until August 14th of next year. The cost is just $81 for you, or $199 for you and your dependents. I will say this plan is much easier to understand than the dental. There's still in and out of network benefits, but there's no type A, B, or C expenses or a deductible. So let's see, once every plan year, so that would be from August 15th until August 14th of next year, you have one eye exam, one pair of eyeglass lenses, or one order of contact lenses, and a frames benefit. So, as I said, the benefits are not the same for in and out of network like for dental. Uh, you would really save the most by staying in network for vision. There's no co-insurance. There's only set reimbursements for certain expenses. Uh, let's see, there's a $10 copay for your exam visit. You have $130 to spend on contact lenses, plus 15% off anything above that 130. There's tons of glasses lens options that are also covered too, such as scratch resistant coating, UV treatment, and more. This is also just a snippet of the full plan summary, which again is on our website. You also will have that $130 yearly allowance for frames and then 20% off anything over that allowance. Um, Lastly, on a high level, you receive up to a 40% discount on additional pairs of glasses or prescription sunglasses. So, having looked at the last slide, you might be thinking, oh, you really have to stay in network with this plan to save. But as you can see, 97% of our members are able to stay in network. So, you've got this. We have over 187,000 providers nationwide, over 29,000 retail and independent locations. There's also multiple online in network options, most with even free shipping. We have those on the next slide, actually. We can flip to those. Yes. So with these online retailers, you do have free shipping and returns, and your insurance benefits can be applied online at checkout. I mean, these are big brand names: LensCrafters, Oakley, Ray-Ban, Target Optical. Just the message, I guess, is that you should not have a hard time staying in network and getting the most out of this plan if you do choose to enroll. Um, I believe for most, if not all of these online providers, though, you do still need a valid prescription. So make sure you schedule that eye exam ASAP if you still need to. Just like with dental, after you enroll, using the same method as before from aetnastudenthealth.com, just select the vision plan option. It's right underneath dental. You'll receive a welcome letter sent to the same address you used when you signed up. It'll look like these two screenshots on the right-hand side of the screen here. Your member ID, the group number, other helpful information, I would say. Just like with dental, you would want to set up your member account online. I want to make note that it is a different website for vision than for the dental and medical. I have the URL right here, but this would be on aetnavision.com. We also have mobile app versions. Same thing, you can download the ID card to your Apple Wallet or something like that. But when registering for this, you can either use the member ID if you have it, or the last four digits of your student ID number that you used when enrolling to create that online account. So different website and app, yes, but like I said, similar capabilities. You can view your benefits. Again, download your ID card, find a provider, check on claim statuses, take a look at special offers, more. Just make sure, yeah, sign up for these apps and secure member websites as soon as you can. And then lastly, just like for dental, here are some resources, links, phone numbers. Again, Columbia's Aetna Student Health page, the Aetna Vision landing page on Aetna's Columbia site, the PDF summary of benefits, the member website login, and the Find a Provider tool. There's also the Vision customer service number for any plan questions, and then again, the Aetna Student Health customer service number if you have any questions about the online enrollment process or want to cancel the plan for some reason. Um, and I think that's all I have. I know we went through that pretty quickly, so definitely feel free to shoot some questions into the Q&A. Be happy to answer those. I hope this was helpful. Yeah,
Hey, Corey, one of the questions that came up in the Q&A that I tried to address was around wisdom teeth removal, impacted wisdom teeth removal, and you might want to quickly review what I put in Q&A, but basically what I've suggested to the student that asked was that oftentimes, most of the time, the medical plan, if you're covered under the medical plan, is a much better option to, have your claim go through medical as opposed to dental. And the reason being is the coverage rate, is much higher under the
yeah,
medical plan as opposed to the dental plan, as well as on the dental plan, you have $1,500 annual maximum that the plan will pay, and not, the medical plan's annual max is much higher. So anything
also
you
true.
want to add to that or about, impacted wisdom teeth removal?
Yeah, so the wisdom teeth would fall under that type C category, and that's where you would pay the most out of your pocket, and our plan pays the least versus like a type A or type B. So the medical plan, yeah, definitely is the way to go if you are dealing with wisdom teeth. Um, I don't know if you had like a specific question, if it was just like one wisdom tooth versus all four, but I hope that was helpful. But yeah, Matt, your answer was spot on. And nine times out of ten, the medical plan is the way to go here, I would say. I'm just reading through the answered ones. And we got open. Type A, B, and C is all $427 per year. Yes. Yes, it is. That is the annual rate. Type A, B, and C is just what is it's how the plan is designed. That's how we classify the different types of dental procedures out there. So yeah, this PPO plan, it's a PPO plan, and type A, B, and C are just part of it and how we classify. But yeah, well, 427 for the full year.
And then, Corey, we have another question that's open that I think might be easier just to answer live, and that's around the member IDs.
Let's see. Just to confirm, is providing Aetna medical insurance member ID sufficient for medical? Good question. I see Angela, you're typing too, but
Yeah, in essence,
oh, I lost it.
I did too, went away. Right.
Yes, Vision has its own ID card. Usually, if you stay in network for Vision, usually the person at the front desk can just look you up, and you don't even need to bring it. But again, if you sign up for the member apps on your phone, you can download those ID cards if they need to ask you for it. Um, if you're going to the dentist's office for like that wisdom teeth, you would probably want to say, I specify I want to use my medical plan here and not my dental insurance because they might have that on file already. But yeah, medical and dental would be the same number. No, sorry, excuse me. Different numbers for all three. Oh, good call out here. Angela just made me aware. Good note that pediatric dental coverage is covered under the medical. So if you were thinking about enrolling them under this PPO plan, that isn't necessary. Thank you, Angela. That's a great call out.
And Corey, there's another open question. I'll try to address it with you. It's basically, is there a way to know how much a procedure might be? So, good question. Aetna does not set the rate for procedures. That would be something that is set by your dentist. However, for most procedures, if you're seeing an in-network provider, an in-network dentist, we have a contracted rate with them for that service. So they should have a pretty good understanding of what exactly Aetna will pay and what you would pay. So when you go for a service at the dentist, if you have something that's beyond kind of your routine cleaning and exam, where they're taking pictures, if you needed like a filling, for example, or even a crown, in those situations, they're probably going to give you an estimate of what the insurance will pay and an estimate of what you will pay. And that's certainly something as a member or as a consumer, you can be asking your dental providers for any treatment.
Good response, Matt. Definitely. And I would say take a look at the plan design online. I can't recall every classification off the top of my head, but take a look at that online. Like I said, there's the cost estimator tool. How applicable that might be. Again, might just be better to reach out to your dentist. But there's definitely different avenues. I know that can get pretty expensive, like you said. So take a look at the plan design. Talk to your dentist. Check out our cost estimator tool. I would say.
All right, if we don't have any more questions, we will have this recording on our website. And again, as Corey mentioned, you have until September 30th to enroll in both the dental and the vision plans. The next time to enroll won't be until December, but the price is the same. So if you want coverage, you should go ahead and enroll. And that's about it. If you have any further questions, you can always email us at Student Insurance. And then we might refer you directly to Aetna Dental or Aetna Vision if you have very specific questions. But otherwise, thank you all for attending. The link to enroll is still in the chat if you want to click on that link. If otherwise, go to Columbia Health's website. Our insurance page will have links to the dental and vision benefits, the registration link. Thank you guys. Have a good
Thank you.
day.
Thank you, Cynthia. Thank you, everyone, for joining. Hope this was helpful.